Charlie, welcome back to my channel. Today I've got a different kind of video for you. I'm going to be talking about what I actually do for my job. So I've said in a couple of my videos before that I am a dental nurse, so I'm just going to be talking through what that actually means and what I do. So if you're interested in hearing that, then just keep watching. Okay, so like I said, I am a dental nurse, and basically what that is the person that sits in the room with the dentist and taps away on the computer. Or at least that's what people just think we do. We actually do a lot more than that. So that is obviously one of our main roles, is doing the notes for the dentist. And the notes are the dentist's responsibility, but to kind of help them out, we'll write them all and then the dentist will check them and then put whatever else he wants or she wants onto them and then send them off. And I always get questions about this from my friends and family, and they say, what are the numbers and letters that the dentists are calling out? And what that is basically just your teeth. So your adult teeth are done as numbers and your baby teeth are done as letters. So you have A, B, C, D, E, E, D, C, B, A, and that's running, you know, top and bottom arch. And then your adult teeth are 1, 2, 3, 4, 5, 6, 7, 8, 8, 7, 6, 5, 4, 3, 2, 1. So yeah, that's what the numbers and letters thing are if you're interested. To assist the dentist, we also do the suctioning. So that is pretty self-explanatory, putting the tube into your mouth while the dentist drills and sucking out all the rubbish that comes out of it. Really pleasant, I know. We have to mix a lot of materials as a dental nurse, so things like the impression materials. So when you have something made in a lab, you generally have alginate impressions, which is that kind of gooey, rubbery stuff that goes in your mouth and sets after about 30-40 seconds. So we have to mix that up, and some nurses load that into the trays for the dentist. We also mix up filling materials, so like amalgam, which is the silver filling. We put that in a little mixer, press the button basically, and then load that into what we refer to as an amalgam gun. So it's in a little pot and you just get the gun, you scoop it all up, and then it's kind of like a syringe that the dentist squeezes the filling out with. A white filling is something different, and generally that doesn't get hand mixed because it already comes in a little capsule. So you load that into like a device, pass that to the dentist, and he'll squeeze it out of there. There's also temporary filling materials which we have to hand mix. So one is called glass ionomer, and you can get this as a capsule that you put in the automatic mixer, or you can hand mix it. And at my practice we have both of them. But to hand mix it, again, this is something that the nurse will do. Put the powder and water together, mix it to a consistency that the dentist will ask for. Sometimes they'll ask for it as a moldable substance, or sometimes a flowable substance. And also with this is what they use to stick in crowns, bridges, anything that kind of sticks into your mouth. That will most probably be glass ionomer. So enough about all the stuff that I mix, because I'm sure you probably don't really want to know that, but just a few examples. We hand mix a lot of materials as part of our job as well. Most dental nurses, if not all dental nurses, are also trained on reception. So you will occasionally see a dental nurse out on reception one day. If there is not many dentists in, then they might be on reception. So we are trained for that, so we do that as part of our job as well. Stock checks is a pretty big one. So the dental nurse is in charge of making sure that the room is completely stocked up. You've got enough of everything. They will put anything that you need ordering into a book, and then there's generally one person in the practice that's in charge of ordering things once a week. As a dental nurse, we also process x-rays, so I don't know of any practices anymore that do this manually, which is where, you know, you go into a dark room and you put the x-ray in one type of solution and then into another, and then you hang it to dry. I don't know of any practices that do that anymore because it's pretty old school to do. It's almost all digital now. So the dentist will take the x-ray and give it to you, and you will run it up to a machine, put it through, and it will come through on the dentist's computer. So pretty simple, but yeah, that's another thing that dental nurses do. Will process the x-rays. Cleaning instruments is another one. So this is practice dependent. So for example, in our practice, we have a decon nurse, and basically short for decontamination nurse. So that nurse will be in one room for a day, and she'll go and collect all of the dirty instruments, put them through a washer, which takes about 40-45 minutes, and then through a sterilizer, which takes maybe 20-25 minutes. However, in some practices, they do this all in surgery. So your dirty instruments you are in charge of. Somebody won't come and collect them and put them in a separate room. Some practices do this all in surgery, and it's exactly the same procedure, but it's just done in the same room. This is a huge part of our job role as well, cross-contamination. You should never ever cross-contaminate for obvious reasons. But yeah, we need to be responsible for keeping one part of it clean and one part of it dirty. And this even includes things like changing your gloves. Basically, every time you touch something dirty and then you need to touch something clean, you need to change your gloves. So if we were doing a filling and the dentist said, can I have this, and I had to get it out the cupboard, I'd have to take my glove off, open the cupboard, get the thing out, put a new clean glove on. Something that comes along with this is the clean down at the end of every patient. Now, obviously a thorough clean down is done at the end of the day, but after every single patient you need to disinfect the surgery. So this will be all the dirty instruments into the dirty box, and then disinfecting the chair, the work surfaces, the light, the door handle, anything that has had any instruments or any person basically on it. Even if that patient is the cleanest person in the world, you have to treat everybody as if they're not. Just because they look really clean, there may be something that they haven't told you, but you basically have to disinfect the surgery exactly the same after every single patient. Don't skip it. Don't think, oh, it's all right. That's what we have to do as a part of our jobs. That is a big part of our job, is disinfecting the surgery after every single patient. And the last thing that I can pretty much think of as part of my job role, this is setting up the surgery at the beginning of the day. So we always tend to get in before the dentist. So for example, I get into work about 10 to 5 to 8 and I'll set up my surgery. For that, I need to put fresh water in the water bottle that works the drill. So the drill obviously squirts out water, you need fresh water in that. Put all the instruments away into drawers. They've been sterilised and everything the night before, so they're in a clean box, wrapped and sealed. So we'll unwrap them, put them in the drawers. Some instruments will stay wrapped until the dentist needs to use them. Again, kind of just stock check the surgery and make sure we've got enough for the day. We will go through the day sheet and see which dental labs we need collecting. Having like a little spray down again, although you've done it the night before, it's better just to do it again in the morning. Just a quick spray around with disinfectant and wiping that all down. Computer on, everything's ready to go. So when the dentists come in, it's all ready and we can call the first patient in, no problem. And yeah, I think that is pretty much it. That's everything that I can think of for now about what I do as being a dental nurse. That brings me to the end of this video. I hope you guys enjoyed this video today. Maybe this gave you a bit more of an insight as to what we actually do as a dental nurse. Don't forget to give this video a thumbs up, click that subscribe button down below, and I'll see you in my next video. Bye!